Hi, my name is Faisal Khawaja, and I'm a pharmacist at Marchese Pharmacy in Hamilton, Ontario. The Ontario naloxone program follows the 5 steps to respond to an opioid overdose. We will be using the terms overdose and poisoning interchangeably during this presentation. If you encounter a situation where you suspect an opioid poisoning, you should observe the following steps established by the Ministry of Health. Step 1. Shout their name, if you know it, and shake their shoulders. In other words, try to stimulate the victim to see if they are able to respond. If they are hard to awaken or not waking up at all, you should look for the following additional signs that might indicate an opioid overdose. 1. Their breathing might be shallow or labored or stopped altogether. 2. Their lips or fingernail beds might appear blue or purplish, showing that lack of oxygen. 3. Their skin might feel cold or clammy to the touch. 4. Their pupils, which is the dark part in the middle of the eye, might appear tiny. Tiny or pinpoint pupils are a sign of opioid use. And 5. Their body might be extremely limp. If you notice any one or more of the signs that I just mentioned, you might consider that the victim is experiencing an opioid overdose, and then you will proceed to step 2. So step 2 is to call 911. Now you may be eager to administer naloxone to the victim because you feel that there's an emergency, but you should call 911 first. So make sure you call 911. If you have to leave the victim, you can do so. Ideally, you'll put them in the recovery position, which we'll talk about at the end. If there's someone else present that you can instruct to call 911, that's even better, which allows you to return to the victim that much more quickly. Once you know that help is on its way, you can proceed to step 3, which is to give naloxone. Start by putting on your gloves. Inside, there are 2 doses of nasal spray. Take one out, peel off the foil, and remove the insert. Take out the device and hold it in your fingers. Fingers on either side, thumb on the bottom. Remember, there's a single dose in there. This is not like any other nasal spray where you have to prime it or get it ready or test it. Do not test it, you will lose the dose. Insert the nozzle fully into the victim's nostril, such that your fingers touch their nostril, and then give a firm, quick push on the plunger, which will deliver the nasal spray dose into the victim's nasal passage. You will observe the victim for 10 seconds and look for signs of recovery. If the victim is not recovering, then you will proceed to step 4, which is to perform rescue breathing and/or chest compressions. Begin by making sure that the victim is on the ground on their back. If you have to maneuver them into this position, please do so very carefully. Then, if you haven't already, put your gloves on. You will open up the victim's mouth, move their tongue out of the way, and using your gloved finger, swish any contents out of their mouth, whether it be food or gum or vomit. Open up the face shield and place it in the victim's mouth, moving their tongue out of the way. Unfold it so that it drapes over their face. Remember, the mouthpiece is for the victim, not for you, the rescuer. So let's say for the moment that that face shield is in there. We have a different one on our mannequin. What we're going to do is we're going to tilt the victim's chin up, we're going to pinch their nostrils, then we're going to give a breath, okay? So when we see their chest rise, we let off and let their chest fall back down, and repeat. So after 3 breaths, we're then going to switch to chest compressions. We're going to take our hand, tuck it under the victim's armpit, drag it straight across. Now we've got the butt of our hand right on the compression spot. We're going to interlock our fingers, bring our weight over the chest, lock our elbows, then we're going to give compressions like this. 1, 2, 3, 4, 6, 7, 8, 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, 20. 1, 2, 3, 4, 5, 6, 7, 8, 9, 30. If they're not recovering, we give 3 more breaths and 30 more compressions. We follow this cycle of rescue breaths and compressions for a total of 5 cycles. This should take between 2 and 3 minutes in total. And step 5 is to decide, is your treatment working? After you've given naloxone and CPR, if there's no improvement, stay with the victim. Repeat steps 3 and 4, that is to give naloxone and CPR, and repeat that cycle of naloxone and CPR until help arrives, or you run out of naloxone, in which case you continue with CPR, or the victim begins to recover. If at any point we notice that the victim is starting to recover, which is essentially they're showing signs that they're breathing on their own, then we want to put them into the recovery position. Remember, we will also put them into the recovery position if we have to leave them for any reason, for example, to call for help. In order to put the victim into the recovery position, make sure that they're on their back. Bend one elbow. Bend up the same side knee. Cradle their head in one hand and use your other hand to grab the knee or elbow and use them as a lever to roll the victim onto their side. Their knee should be well draped over their side. Their lower arm should be extended straight up above their head. Their upper hand should be tucked underneath their cheek, and their face should be pointed downward so that if they happen to vomit, they will not choke. This also makes it easier for them to breathe. Then stay with the victim until help arrives.